Hello, everyone. This video is about the deep 6 lateral rotators of the hip. The deep 6 are, of course, 6 deep muscles. Specifically, they're deep to the gluteals. And what they do is they laterally rotate the femur, and they also help to stabilize the hip when standing. We are going to talk about the deep 6, but you really only have to know the origin and insertion and action for one of them. Yay! So let's see which one it is. Okay, we're on page 328 in your book. And here are the deep 6 lateral rotators. So as you can imagine, they are all going to laterally rotate the hip. This one right here is piriformis. That's the one we're going to start with, and that's the one that I want you to know. Piriformis is sort of the star of the lateral rotator show. It is the most superficial of the 6, and it is the one that we can access or palpate. Piriformis also happens to have a position that places it right on top of this structure right here. This is the sciatic nerve. The sciatic nerve is the longest nerve in the body, and at some places it can be as large as a quarter. So it is a large, long nerve. And when it's compressed, it sends pain, numbness, tingling down the back of the leg, all the way to the foot in some cases. So it is literally a pain in the butt. And piriformis can have a role in that. So piriformis, it's right here. Its origin is actually the anterior surface of the sacrum. So we are talking about we're talking about this surface. So remember, you can tell the difference between the posterior and anterior because the posterior has the little spikes where spinous process is on the back. Anterior is nice and smooth. So piriformis arises from the anterior sacrum like this, and then goes straight across to insert on the superior aspect of the greater trochanter. So right on the top here. Right on the top of the greater trochanter, just like that. So its fibers are almost directly transverse. Not quite, though. In an actual person, they're more diagonal than that for most individuals. We'll be able to find it nonetheless because it is sort of bulky. It has a rounded feel to it. And like I said, it is superficial. So we'll have to go through the glutes to get to it. But as far as the rest of the deep 6 are concerned, it's easy to palpate, okay? So we have surface of the anterior of the sacrum to the superior aspect of the greater trochanter. Now, of course, this is a deep 6 lateral rotator, so it laterally rotates the hip, of course. But piriformis can also help abduct the hip when the hip is flexed. So if you think about a flexed hip, think about hip flexion. So hip is flexed, then piriformis can help abduct the hip when it's flexed, kind of like a dog lifting their leg on a hydrant. That's what that would look like. Okay. So piriformis is the only one of these that I want you to know the origin, insertion, and action for. The others, I want you to know approximately what they look like and where they are, but I am not interested in O's, I's, and A's for that, okay? All right, so the others that we have gemellus superior and gemellus inferior. And actually, gemellus means twin. In fact, we have an astrological sign, Gemini, which also means twin. So it's from the same root word. The Gemelli sisters, let me see, they're on the next page. The Gemelli sisters actually look like little cigars. Let me get those up here. There we go. See the little Gemelli superior and Gemelli inferior. Obviously, the superior one is above the inferior one, but they look like little cigars or little twisted up pieces of paper here. Okay. And that's an interesting thing to note because it means that the fibers themselves are twisted like that. So when they contract kind of like a spring. Do you know what I'm saying? We have several muscles in the body like that actually have a rotation or torsion to them. Torsion is a term that I want you to know. Torsion means twist. You have a bunch of different words in the English language that come from that root word, torge, T-O-R, which means twist, like torque, you've maybe heard of before. But torsion means twist, and we have normal torsion in muscles like gemellus superior and gemellus inferior, but sometimes we can have abnormal torsion in muscles where they actually tighten up in a twisted manner. And in that case, of course, we have to try to untwist these muscles with various massage techniques. All right, so those are the gemelli. Now, we also have the obturators, obturator internus and obturator externus, and they sit on either side of the obturator foramen. So obturator internus is here, obturator externus is here. Oops, I'm sorry. Externus is over here. Yep. Obturator internus is over here. And actually they have an attachment on not just the obturator foramen, but it's a membrane that actually covers the whole obturator here. So there's a membrane here and a membrane here. And these muscles, see, have an origin on the obturator membrane. All of these muscles attach to the greater trochanter or to the femur in some way, which is why they laterally rotate. But the obturators here attach on either side of the obturator foramen. And oddly enough, the word obturator means obstructor. So these are obstructing the obturator foramen. And last but not least, we have to go back a page, actually. Here we are. We have quadratus femoris. Quadratus, quad means four. And what we're really talking about when we have a quadratus type of muscle is kind of a rectangular shape. So four sides maybe, or I would assume, because it doesn't have four attachments. It's not like the quadriceps, which has four heads. This is a quadratus or quadratus, like a quadrangle, which is a square. Okay, so four sides. All quadratus muscles look like this. They're rectangular shape. Okay, so quadratus femoris is right here. And again, they all laterally rotate, but piriformis is the only one that can do something extra. It can abduct the hip when the hip is flexed. Now, as I mentioned about piriformis, its position on the sciatic nerve can affect the sciatic nerve. In other words, if piriformis is tight, it can put pressure on the sciatic nerve and cause sciatic symptoms. So we can work piriformis to loosen it up or to reduce the adhesions in the muscle itself and take pressure off of the sciatic nerve. We'll do that really more in NMT, not so much in Swedish. But that's why we talk about piriformis, because it can cause sciatica It's really called pseudo sciatica because it's not true sciatica, and I'll talk about the difference later, but that's piriformis for you. So those are the deep 6 lateral rotators of the hip. And that's it for this video. See you soon.